the social model of health. The social model of health starts primarily with a denial or a challenge to the biomedical model of health. The social model of health is a number of different things under the one label, and it's kind of looking at the criticisms of the biomedical model. And if I was to say what it does is to suggest, first and foremost, that there is more than one way of seeing, viewing, approaching medical treatment, which is, as you'd understand, directly opposed to the idea of the Western notion of scientific approach, the biomedical approach to health. It suggests that the person should be dealt with holistically, not apart, not head removed from body, the whole person, and the person's life and lifestyle taken into consideration. This is what they mean by a holistic approach. It denies the one-way narrative. It challenges the cultural dominance of the scientific approach to medicine. Understandably, part of the approach is, if you like, going back to traditional medicines pre the scientific revolution. It's also looking at herbal medicines globally, Chinese medicines, and so forth. It is offering as a supplement or as a substitute alternatives to the culturally dominant biomedical version of health treatment and health care. It's looking for a broader range of factors, a broader range of ways in which to view an individual's or a community's health. More specifically, it points to the fact that socioeconomic factors drive poor health outcomes. What I mean by that is the poorer you are, the more likely you are to be ill. There is a direct correlation between the two. So poverty is a cause of ill health, rather than this biomedical approach which sees it purely as a machine and the machine part being replaced in this way. The other factors would be things like gender. Women report more illness than men. There seems to be a significant factor in that. And women live longer on average than men tend to. There are therefore gender issues. Health can be seen through the prism of gender. Likewise, ethnicity. Different ethnic groups suffer illnesses in different ways, or have different approaches or different viewpoints to illness. So looking at these areas in terms of how to treat them, the visually impaired, wheelchair users, so on and so forth, are also looked at as whole beings rather than their ailment, etc. It is very much social model of health grew out of the campaigning, particularly of those that felt disabled by society. That is, those people who are wheelchair users or who have other physical impairments that feel that society sees them as their disease rather than a whole person. The idea of empowerment there is key to the social model of health. It is to prevent the end user, the patient, simply being treated as an item on a list. It is about empowering those that need health services to be articulate, to be knowledgeable about their condition, to be able to stand up and participate fully in their regime of care, and to have a voice and maintain that voice. Part of this is challenging inequality, not only economic inequality. Poverty drives ill health, then inequality itself is a factor for ill health. And so inequality itself needs to be challenged, not just financial, but also when we talk about gender issues, we talk about ethnic minorities, and we talk about the physically impaired. It is about challenging massive inequality. There is a great deal of data that suggests that the more unequal a society is, the more it suffers from rates of morbidity and morbidity. So it is important from this point of view. Remember, it comes out of the challenge to conventional wisdom or medicine, and it comes out from advocates specifically of those physically and mentally impaired. It is also, which is linked to the above, the idea of access to health care services. It is still true in our society that the richer you are, the better access you have to healthcare services, which may explain why there is such disparity in terms of health outcomes between the rich and the poor. So it's campaigning for all to have the availability to healthcare services that is based on need and not on money. Lastly, it looks at a coordinated approach, coordinated colours. But there, instead of coordinated colours, what we're talking about is a coordination of the agencies. So various parts of the National Health Service, the social services, if you like, the police service, who interact with each other in providing or observing or delivering healthcare to the nation. So it is to put the individual knowledgeable, empowered, aware of their rights at the heart of a bespoke package of measures.